Okay, Doug, I'm going to show you some techniques that might help with your plantar fascia problem. First of all, we'll go over some calf stuff. All the stuff you described in your email is good, but what I'm going to show you is more aggressive and is more likely to work, although you still may struggle with it for a while. So this is stuff that you should probably do at least once a day. Certainly you should do it in the morning before you start hobbling around on your feet. So you want to get into your calves, take your two thumbs, make like an arrowhead with your two thumbs, and just do nice, deep, slow lines all through the bottom half of the calf. I see I'm working the medial side a little more now. And the tendon comes up here, and then between here and here there's kind of a myotendinous area where the tendon merges into true contractile muscle tissue. So basically from here all the way down to the calcaneus is what you're really interested from there to there, on the medial side, right up the back, and on the outside. So you can kind of pick spots and just run these lines. I'm going pretty deep. You can tell that by how white my thumbnails are going. Well, hopefully you can tell that. And you may not be able to run these lines all the way down to the calcaneus straight away. Mine's pretty tender, as you can see. I'm not inclined to make these lines go all the way to the calcaneus just yet. So I'm going to do a bunch of lines like this. Then of course you want to treat the other foot, even though usually this problem is either present only on one leg or at least much worse on one leg compared to the other. You definitely want to do this on both sides. Can't stress how important it is to treat both legs. Otherwise you'll fix the problem on one side and a month later you'll be crippled with pain on the other side. So that's nice and tender. See how slow I'm going? So it's slow, deep, dry strokes. There's a lot of skin burn and heat and friction, and that's what it takes to get the fascia to heat up and creep and lengthen. All right, so 8, 10, 12 strokes, then switch to the other side. Now I'm going to do the outside of this calf now because I didn't do that before, so this is a little trickier. It's kind of harder to reach, but again I get my arrowhead formed up with my thumbs. Dry strokes, deep, slow. It's basically like rolfing. That's kind of what you're doing. The other option you have, especially on the outside here, where it's tough to reach with the thumbs, is to use the heel of the hand. And this won't be as painful. So this might actually be a little bit better for the first few strokes until you warm the area up. And now I can start to extend the stroke all the way down to the calcaneus, which obviously we have to deal with. We've eventually got to go into the bottom of the foot. So you can see how white everything's going all through here. So you're getting all the way down. And it may well be that yours is so tight and so tender that you have to use the heel of the hand initially and then progress to the thumbs later. So I've run those lines all the way down, so now I do the other side. So I'm using this part of my hand predominantly. You can see how much pressure I'm using. I'm really leaning in pretty good, like there's a lot of my body weight going through that. You can go right down the back of the fibula here, so you see that tendon, that's the peroneus longus. I can basically scrape my way down that tendon, heat the fascia up, and then drop over onto the calcaneus, right down the back of the Achilles tendon there as it attaches onto the calcaneus, all the way, starting to make my way now into the bottom of the foot. And it's hot. When I put the back of my hand on here, I can feel it's hot because I've heated it up. So remember, no lube. Okay? Now, you do all of this first, then you get into the bottom of the feet. And you need to do all of this, like I said, in the morning before you start walking around on your feet. So you do the soft tissue work first. So a couple of choices here. You can try it with your hands. So you just pull extend the toes like so, which pre-stretches all the fascia in here, and then just take your fingers and slide through the bottom of the plantar fascia. So the first tendon you feel here, in line with the big toe, is the tendon of flexor hallucis longus, and then flexor digitorum longus. Those 4 tendons are more lateral. So just kind of work your way from the metatarsals. The metatarsals are here, all the way to the calcaneus. And it won't work if you just do that. If you do that, see my toes are moving. So what's happening is there's no tension at all in the fascia and the tendons back here. I have to maintain maximal tensile load on all this stuff by pulling the toes into full extension before I even do the stroke. Otherwise, you won't feel like anything is happening. So do a bunch of strokes like that. Again, it's pretty deep, it's slow, it's dry. Then I switch legs again, pull the toes into extension. Nice, slow, deep strokes, working through all the painful spots. I would do at least 8, 10, 12 strokes. Don't rush it. Right, now you've got to treat the outside, because that previous treatment I showed you was biased towards the inside of the foot. So now I extend the toes and I get right in the lateral part. Obviously, you spend the most time where the worst of your symptoms are. Whoops, slided. So you should be creating friction on the skin. Skin should get hot. You should feel some skin burning. Then we do the outside of the other foot, like that. Extend the toes. I'm just using 4 fingers like that, really pulling my hand into my foot and then gliding down the foot. Really important to keep these toes fully extended. Now, this may still be a little bit easy, in which case what you're going to need to do is get something like this. Some kind of a pressure bar, or even a pinch, even a screwdriver with a plastic handle on it will do. But these are NMT pressure bars. This has got a plastic round sphere on the end. This is rubber. The harder the better, but a normal screwdriver with a rounded plastic handle will do. You just take the handle, not the blade end obviously, get in here and then just start doing slow strokes, and you will definitely feel this. And that is way more invasive. So you just kind of make your strokes, try not to slip and slide. Again, keep all this tissue here on a significant tensile load, otherwise you won't feel much is happening. And you know, you can really dial in your treatment now. So, you know, some people will feel the most pain on the inside of the heel here, some people on the outside, some people it's more in the middle of the arch. So you've got to focus, treat the whole of the underneath of the foot, but spend more time specifically on the areas that feel like they're tightest. So work through that. And do the other foot, same thing. Just nice, slow strokes. Come up here, treat from the metatarsals to the midfoot as well. This is very tender, so you're unlikely to be able to start the stroke here and go all the way through there, through the calcaneus. That's probably going to be too painful. So pick your battles and release it in sections. But the message is, don't leave any portion of the bottom of the foot untreated. You need to treat the entire area from the metatarsals all the way through to the back of the calcaneus, both medially, right down the center, and laterally. Okay? And you'd repeat that a couple of times, going back and forth on each foot. So you do all of this in the morning before you walk around on your foot. And then once you've done it, you grab the toes and dorsiflex the ankles. Remember, dorsiflexion is that movement. That's plantar flexion. That's dorsiflexion. And give it a good stretch. Hold it for 30 seconds minimum, maybe even a minute or more. So you're stretching the fascia on the bottom of the foot. And then after a minute, dorsiflex the other foot, yank on the toes so you get a good stretch through here and hold it. Normal principles for fascial stretching. You could go longer than a minute, although to be honest in this case you've heated and pre-stretched the tissue so much with the massage that probably a minute will be sufficient. Normally I'd recommend much longer than that for a fascial stretch. Right, and then the last bit is before you get out of bed and walk around for the day, put some shoes on that have heels. Not high heels, although you may like that. Like a running shoe where the heel is fairly substantially off the floor compared with a forefoot. What you don't want to do is walk around barefoot because that re-tears the plantar fascia. That's why it's so painful first thing in the morning when you have plantar fascia pain. So put on a shoe. Crocs are good. Have a pair of Crocs right by the bed so you do all this palaver with the treatment and the stretching, and then you stick your feet in a pair of Crocs and walk around in Crocs. Don't walk around barefoot. You want your heel further from the ground than your forefoot so that your ankle's kind of like this, not that. And that will help prevent this tearing of immature scar tissue that's laid down at night. One more tip for you. Go online and buy a Strasbourg sock. Roadrunner Sports has them. Just Google Strasbourg sock. I forget the spelling. It's S-T-R-A-S-S-B-O-U-R-G or B-E-R-G, something like that. Anyway, it's a sock that you wear at night that basically locks your foot and ankle in dorsiflex position and extends the toe so it keeps all this fascia on stretch all night long. And that often it works very well to break this cycle so that you can run again without pain. Okay, give that one a whirl.